Hello, everybody. Happy Friday. Dr. Aimee Ostick here with Health and Healing Direct Primary Care. So it's been quite a week here in LA County when it comes to the number of cases of COVID, and really our fatality rate or mortality has taken a bit of an increase in the last 24, 48 hours. And usually there's a lag time when we start seeing cases increase. Obviously, people that don't do as well and end up passing away from this disease, usually about 1 to 2 to 3 weeks after even they were first diagnosed. So the mortality rate kind of stayed kind of low for a little bit, and then it peaked yesterday at 55 cases, 55 deaths yesterday in LA County, 2,200 more cases of COVID-19. We're over almost at 110,000 cases here in LA County. This is not really a surprise. I have a new blog on my website, healthandhealingdpc.com, talking about, really this particular issue. We've seen an uptick in cases about 3 to 4 weeks after we started reopening LA County in terms of restaurants and bars and going out, workplaces, beaches, activities. And there's more mixing, there's more exposure. I am personally seeing here in my office a huge increase in testing. And what that has done is then really overwhelmed the laboratories. We use 3 different vendors here, looking for a 4th. Overwhelmed the laboratories in terms of processing. So now what went from a 48-hour turnaround time for a PCR swab test is now 5 to 7 days, which is just not good when it comes to trying to risk assess people and rule out cases. So rapid testing is available, becoming more and more available now. So hopefully that will be part of our milieu when it comes to ruling out COVID-19 with either a high-risk exposure patient or a symptomatic patient. But in general, where I've seen the largest increase in cases has been in the younger population, 20 to 40-year-old range, in patients who have been in large group settings, higher risk settings, bars, restaurants, unmasked, house parties, and then 5 days later, they come down with symptoms and that are consistent with COVID-19. So as we reopen, as we look to our holiday weekend, July 4th weekend, tomorrow, we have to be really careful and diligent about how we go about our activities. And we know people are going to mix, and we know people are going to be around one another, and that is okay as long as we are doing it safely. There's a lot of great guidelines on LA Department of Public Health about how to do this safely. There's some great guidelines on the CDC website, but it comes down to really, and on my blog I go over the 3 basic things. Universal masking, it only works if we're all doing it. So if you're going into a group setting, even if it's a small group gathering, wear a mask. Everybody should be wearing masks. Period. Okay? That is going to significantly lower the transmission. And we know that through lots of studies done with universal masking. Hand hygiene. Again, this is when it comes to healthcare workers, there's actually some good data looking at why healthcare workers in New York and in Philadelphia actually have a lower incidence in some cases of contracting COVID-19 than the general population. And that comes down to the masking and the hand washing. We have a protocol before we enter an exam room. We hand sanitize before we enter. We maybe, before pre-COVID-19, maybe we shook somebody's hand or whatnot. We hand sanitized. We use the computer. We hand sanitize after using the computer. We did our physical exam. We hand sanitized right after. We use the computer again. And then we hand sanitize after and we leave. Probably 4 to 5 times in one patient encounter. Extrapolate that after typical practice, maybe 20 patients. That's over 100 times you're washing your hands. So think about that. Every time you're touching a surface, you're just sanitizing. And certainly before you're touching your mouth or you're eating. And that's why we are teaching our kids washing your hands before you eat, washing your hands after you eat. And then physical distancing. This is really big. There is plenty of studies in looking at these respiratory droplets that are heavy that fall to the ground within 6 feet of being expressed out of somebody's mouth. And when they're either talking, when they're singing or shouting, that velocity is higher, so it may go further. So what you're seeing why people are in their choir lofts, whatever, they're 12 feet apart maybe, or in gyms even 12 feet apart, because if you're heavy breathing or shouting, that velocity, that projection and that distance is going to be further. But that 6 foot distance in general, if we keep to that, again, our transmission will be much less. And then you add a mask to it. This is the lowest risk scenario. Masking, physical distancing, that's how this virus is spread. You know, and then when you add the whole gloving and touching surfaces, again, we've gone through this, has not been a really significant route of transmission, so I'm not as concerned with that. But when it comes to sharing food this weekend in different settings, if they're at somebody's house or whatnot, I encourage you maybe to bring your own food to use, because you think about just dipping and double dipping and things of that nature, or sharing obviously utensils and salads and things. So bringing your own set of silverware, utensils, and food, those are all really great ways, and disposable cups, really great ways to stay safe through this holiday weekend. You know, there's a lot of anxiety around everything we're doing now. There's a whole nother level of fear when we engage or we see people or we see somebody without a mask. I mean, it can just spiral and make us go perseverate on that exposure or that experience. And as long as we are doing the things and being diligent about our practices and engaging with people who are similar minded that way, and a small subset of people, we will really lessen our risk of exposing and getting this coronavirus. It doesn't mean forever, because at some point you cannot control everything. And as the prevalence increases, you're more likely to be for that virus to kind of maybe come into your circle. And so what we were trying to do now is protect our vulnerable patients. So the people that are at most risk need to stay the closest shut down. Our pregnant patients, our older patients, people with diabetes, COPD, asthma, we need to protect them the most. And if you aren't in that category, you may have a larger social circle or do more things, staying safe, wearing a mask, hand washing. This virus is not done with us. But we have to also recognize that anxiety and realize that we can't let that control our day-to-day activities and our fear. Let us control our activities. Be rational, be thoughtful about the risk, and do the best you can to lessen that risk. And just stay safe. We're here for you at Health and Healing Direct Primary Care. We've seen a huge uptick in cases this week, and we are praying for all of those that are, dealing with the anxiety, number one, of contracting it, and maybe that our patients that are sicker and more at risk. We hope that everybody stays really safe this weekend. It's going to be a different type of 4th of July weekend, but I believe that these are lessons that we're learning for the lifelong, and that overall will be beneficial to us. We'll learn new ways of gathering, new ways of sharing, and enjoying each other. So happy 4th of July, everybody. And if you need us, call us at 818-600-2426, healthandhealingdpc.com. Dr. Aimee Ostick here, signing off.